contact lens insertion and removal. Genuinely, nobody has asked me to make a video on this, but you know me, I do what I want to because I think it's important to know how to insert and remove contact lenses. There are multiple different methods, but this is my particular technique on how to insert and remove. You don't need to follow it. As I said, it's not a learning resource tool. So first things first, break the spine. But before that, you notice I wash my hands. Hygiene is very important. You cannot put an optical appliance in a patient's eye if you haven't washed your hands. So once you've broken the spine, take the contact lens out. Now there is a correct way. I'm trying to demonstrate here. You'll notice the correct way, the lens should form a bowl. If it's the wrong way, there'll be a bit of a lip on the edge of the contact lens. That's one way to know. It doesn't usually affect the vision, but it affects the comfort. And with contact lenses, because it's something that's going into the eye, comfort is extremely important to the patient. Once you establish the correct position of the contact lens, you can then place the contact lens on the index finger of your dominant hand. Try and place it towards the edge. Instruct your patient to look down. You can let them know it's going to feel cold and wet when the lens goes in, and then use your non-dominant hand and strongly or firmly lift up their eyelid, make the patient look up, then use your middle finger of your dominant hand to pull the lower lid down, and then place the lens onto the surface of the eye with your index finger. You should hear this squelchy pop noise to suggest that the lens has suctioned onto the eye, removing any air bubbles. If you notice an air bubble, you can make the patient look in different directions to get rid of that air bubble. If it didn't go in the first time, don't worry. Go ahead, try again, repeat those steps. Now I'm just going to show you how it goes into the eye on myself because I just can't seem to get any volunteers. But there we are. That's exactly how I would do it. Again, you'll notice that I look left and right to remove air bubbles. Now the lens is in the eye, I can remove it myself. But if you were going to remove it on the patient, what you would do is pretty straightforward. Using your non-dominant hand, lift up the top lid. Using your dominant hand, lower the bottom lid using your middle finger, and then use the index finger to slide the lens. You can touch the lens, slide it to the temporal canthus, and then you pinch on the conjunctiva, and that is how you successfully remove a contact lens. To stay on STEM Talk, make sure you repost this video and click follow. You're welcome.